Hello guys, how are you? I think so you would be fine and enjoying good health. Today I have selected a topic on brain tumor and its risk factors, symptoms and treatment. The brain tumor is a collection or a mass of abnormal cells in your brain, your skull which encloses your brain and is a very rigid. Any growth inside such as restricted space can cause problems. Brain tumors can be cancerous, malignant or non-cancerous, benign. When benign or malignant tumors grow, they can cause the pressure inside your skull to increase. This can cause brain damage and it can be life threatening. Brain tumors are categorized as primary or secondary. A primary brain tumor originates in your brain. Many primary brain tumors are benign. A secondary brain tumor, also known as a metastatic brain tumor, which occurs when the cancer cells are spread to your brain from another organ, such as your lung or breast. Benign versus the malignant brain tumors. Though benign brain tumors can cause many serious issues, they are not cancerous, meaning that they grow slowly and do not typically spread to other tissues. They also usually have more clearly defined borders, making them easier to remove surgically and do not usually come back after removal. On the other hand, malignant brain tumors are cancerous, grow rapidly, can spread to other parts of your brain or central nervous system, which can cause life-threatening complications. Then I will tell you about the types of brain tumors. Primary brain tumors, which originate in your brain, they can develop from your brain cells, the membranes that surround your brain, which are called meninges, and the nerve cells, and the glands such as the pituitary or the pineal gland. Pituitary tumors can be benign or cancerous in adults. The most common types of brain tumors are gliomas and meningiomas. What are gliomas? Gliomas are tumors that develop from glial cells, and these cells normally support the structure of your central nervous system, provide nutrition to your central nervous system, clean cellular waste, break down the dead neurons. Gliomas can develop from different type of glial cells. The types of tumors that begin in the glial cells include the astrocytic tumors, such as astrocytomas, which originate in the cerebrum, oligodendroglial tumors, which are often found in the frontal temporal lobes, and the glioblastomas, which originate in the supportive brain tissue and are most aggressive type. The type of primary brain tumors which include pituitary tumors, which are usually benign, and the pineal gland tumors, which can be benign or malignant. Ependymomas, which are usually benign. Craniopharyngiomas, which occur mostly in children and are benign but can have clinical symptoms like changes in vision and premature puberty. And the primary central nervous system lymphomas, which are malignant, and primary germ cell tumors of the brain, which can be benign or malignant, and the meningiomas, which originate in the meninges, and schwannomas, which originate in the cells that produce the protective cover of your nose, myelin sheath called Schwann cells. Meningiomas are diagnosed more often in women than men, according to the study group participating to a man and woman. Schwannomas occur equally both in men and women. These tumors are usually benign, but they can cause complication because of the size and locations. Cancerous meningiomas and schwannomas are rare but can be very aggressive. Then there are secondary brain tumors. Secondary brain tumors make up the majority of the brain cancer. They start in one part of the body and spread or metastasize to the brain. The following can metastasize to the brain, such as lung cancer, breast cancers, kidney cancer, and the skin cancer. Secondary brain tumors are always malignant, and benign tumors don't spread from one part of the body to the another. What are the risk factors for a brain tumor? There is a family history. Only about 5 to 10% of all cancers are genetically inherited or hereditary. It is rare for a brain tumor to be genetically inherited. Talk with your doctor if several people in your family have received a brain tumor diagnosis. Your doctor can recommend a genetic counselor for you. And age is also a risk factor. The risk for most type of the brain tumor increases with the age. And then the chemical exposures. Being exposed to certain chemicals, such as those which might fight in a work environment, can increase your risk for brain cancer. The National Institute of Occupational Safety and Health keeps a list of potentially cancer causing chemicals found in workplaces. And then there is the exposure to the radiation is also a risk. People who have been exposed to ionizing radiation have an increased risk of brain tumors. You can be exposed to ionizing radiation through high radiation cancer therapies. You can be exposed to radiation from nuclear fallout. The nuclear power plant incidents in Fukushima and Chernobyl are examples of how people can be exposed to ionizing radiations. And according to 2016 review published in Cancer Medicines, having a history of childhood chickenpox is associated with 21% lower risk of developing glioma. What are the main major symptoms of brain tumor? Symptoms of brain tumors depend on the location and size of the tumor. Some tumor causes direct damage to by invading the brain tissue, and some tumors cause pressure on the surrounding brain. You will have noticeable symptoms when a growing tumor is putting pressure on your brain tissue. Headaches are common symptoms of a brain tumor. You may experience headaches that are worsened in the morning and when waking up occurs while you are sleeping, are made worse by coughing, sneezing, or exercise. You may experience vomiting, blurred vision, or double vision, which is diplopia, confusion, seizures, especially in adults, weakness of the limb or part of the face, a change in the mental functioning, and the paresthesia. Other common includes clumsiness, memory loss, confusion, difficulty writing or reading, changes in ability to hear, taste, or smell, decreased alertness, which may include drowsiness and loss of consciousness, and difficulty in swallowing, dizziness or vertigo, eye problems such as dropping eyelids and unequal pupils, and uncontrollable movements, hand tremors, loss of balance, loss of bladder or bowel control, numbness or tingling on one side of the body, paresthesia, trouble speaking or understanding what others are saying, changes in mood, personality, emotions, and behavior, difficulty walking, muscle weakness in face, arm, or leg, and symptoms of pituitary tumors, which might include nipple discharge or galactorrhea, lack of menstruation in women, development of breast tissue in men, or gynecomastia, enlargement of the hands and feet, and sensitivity to heat or cold, increased amounts of body hair or hirsutism, low blood pressure, and obesity, changes in vision as blurry or tunnel vision. How are the brain tumor diagnosed? Brain tumors can be benign with a physical exam and can look at your physical history. The physical exam includes a very detailed neurological examination. The doctor will conduct a test to see if your cranial nerves are intact. These are the nerves that originate in your brain. Your doctor will look inside your eyes with an ophthalmoscope, which is an instrument which shines a light through a pupil and onto your retinas. This allows your doctor to check how your pupils react to the light. It also allows your doctor to look directly into your eyes to see if there is any swelling of the optic nerve, and pressure increases inside the skull. Changes in the optic nerve can occur. The doctor may also evaluate your muscle strength, coordination, memory, ability to do mathematical calculations. Your doctor may order more tests after they finish the physical exam. These could include the CT scan of the brain. CT scan are always used for your doctor to get a more detailed scan of your body than they could have by the X-ray machine, and this can be done with or without the contrast. Contrast is achieved in a CT scan of the head by using a special dye that helps doctor see some structures like blood vessels more clearly. MRI of the head is also done, and it is a special dye that can be used to help your doctor detect tumors. An MRI is different from a CT scan because it doesn't use radiation, and it generally provides much more detailed pictures of the structures of the brain itself. Angiography is also done, and this study uses a dye that is injected in your artery, usually in the groin area, and the dye travels to the arteries into your brain. It allows your doctor to see what the blood supply of the tumor look like. This information is useful at the time of surgery, and X-rays of the skulls are also used, and brain tumors can cause breaks or fractures in the bones of the skulls, and specific X-rays can show if it has occurred. These X-rays can also pick up the calcium deposit, which are sometimes contained within a tumor, and calcium deposit may be seen in your bloodstream if your cancer has moved to your bones. And then biopsy, a small piece of the tumor is obtained during a biopsy, and a specialist called a neuropathologist will examine it. The biopsy will identify if the tumor cells are benign or malignant. It will also determine whether the cancer originated in your brain or any other part of your body. Treatment of the brain tumors depends on the type of tumor, the size of tumor, the location of the tumor, the general health of the patient. The most common treatment for the malignant brain tumors is surgery. The goal is to remove as much of the cancer as possible without causing damage to the healthy part of the brain. While the location of some tumors allows for a safe removal, other tumors may be located in areas that limit how much of the tumor can be removed. Even partial removal of the brain cancer can be beneficial Risk of brain surgery include infection and bleeding. Clinically dangerous benign tumors are usually surgically removed. Metastatic brain tumors are treated according to the guidelines for the type of the renal cancer. Surgery can be combined with other treatments such as radiation therapy and chemotherapy. Physical therapy, occupational therapy, and speech therapy can help you recover after neurosurgery. And if you have any brain tumor diagnosis, there are several questions you will want to ask with your team before, during, or after treatment. How are the questions you should consider asking your doctor? What type of brain tumor do I have? Is my tumor benign or malignant? What is the tumor located and has it spread to other areas? Should I get a second opinion? What are my options for treatment? How long will treatment take and what should I expect? How can I manage any side effect I may experience during treatment? What is the outlook for my condition? Is there anything I should do to prepare for the treatment? Can you recommend a mental health professional I can talk to if feel overwhelmed, anxious, or depressed? The treatment for brain tumors is often successful and it is possible to fully recover. However, the outlook for a brain tumor that depends on different several factors, including the type and size of the tumor, location of the tumor, and your general health. Seeking treatment early can prevent complications that can occur as a tumor growth and puts pressure on the skull and brain tissue. It may also help prevent malignant tumors from spreading to other tissues in the brain. Your doctor can help determine the best course of treatment for you to prevent complications and manage the symptom you may experience. So, what is the brain biopsy? The brain biopsy is used to diagnose illness. It is a procedure, a tumor or a piece of tissue is removed from the brain for examination under a microscope, and the type of biopsies include needle biopsy, stereostatic biopsy, and open biopsy. In a needle biopsy, a hole is drilled into the skull and narrow hollow needle is placed into the incision to extract a tiny portion of the tumor or tissue. A stereostatic biopsy uses 3D imaging technology as well as data from the CT and MRI scans to examine a tumor or a size or a piece of the brain, and a stereostatic biopsy is a minimally invasive procedure. Open biopsies are the most common form of brain biopsies and the most invasive, and during the procedure, your surgeon will remove a piece of the bone from your skull while you are under general anesthesia. This allows the tumor to be exposed and removed, and this is the riskier than other brain biopsy methods, and the recovery time is longer. A brain biopsy can help doctors diagnose brain illnesses, allowing them to devise treatment plans. Doctors usually order brain biopsy to determine whether a tumor is cancerous or benign. It can also be ordered to confirm the diagnosis of Creutzfeldt-Jacobs disease, a dementia-related disease, inflammatory disorder. Infections can also be identified through brain biopsy. A brain biopsy is seen as a last resort for diagnosing an illness and is performed after imaging techniques prove inconclusive. In the case of dementia, the role of the brain biopsy is sometimes used for diagnosis, but the practice still remains uncertain, and the research shows that the procedure may become more worthwhile for diagnosing dementia as new therapies are discovered. But now, for diseases such as Alzheimer's are usually diagnosed clinically and through imaging tests. Brain surgery is always risky, but needle and stereostatic biopsies are less invasive than open biopsies and they have a fewer complications. Going under anesthesia always poses risk for older adults and people with dementia. All types of brain biopsies can result in swelling or bleeding in the brain. They can lead to infection, seizures, stroke, and coma. Sometimes tests on the sample's tissues are inconclusive and the procedure must be repeated. Risks have been reduced with modern technology such as stereotactic equipment. Lab work and CT scan or an MRI may be ordered before your surgery. Your doctor may ask to discontinue using blood thinners and aspirin. You may need to wash your hair with a special shampoo for the night before surgery. And brain biopsies are performed in hospital operating rooms. Your surgeons may place a head ring on you, which is held in place with pins. In some cases, a CT or MRI is taken in conjunction with the biopsy, often with the head ring in place. In other cases, the CT scan or MRI is taken before the biopsy and the results are uploaded into the surgical equipment. This eliminates the need for a head ring. If in needle or stereostatic biopsies, a small incision or a few millimeters long is made, tiny hole is drilled into the skull, a small needle is placed into the brain, and the biopsy is obtained. If the biopsy is remotely controlled, your doctor can navigate the needle during surgery by watching a monitor. After surgery, the incision is stapled or sutured. In the case of open biopsies, the bone flap is replaced with plates of wires If there is swelling or infection, the flap would not be replaced. This is called as craniectomy. What is the outlook after brain biopsy? Your doctor will go over the results of the biopsy with you and come up with a treatment plan if needed. In some cases, particularly with stereostatic and needle biopsies, you may go home on the same day, although 1 day hospital stay is usually required. The hospital stay may be longer depending on your health and whether many complications arise during surgery. So that was about the benign and malignant tumors. When you hear the word tumor, you would think of cancer, but in fact, many tumors are not cancerous. What are the benign? The tumor doesn't contain cancerous cells. Pre-malignant or cancerous cells, it contains abnormal cells that have the potential to become cancerous, and malignant are the tumors which contain cancerous cells. So, I have covered this topic in a on a large extent, and I think that it will be very helpful for you, for my audience, and um, if you have liked my video, then don't forget to subscribe it. Thank you for listening my video. Thank you very much.